I appreciate you all joining us for this amazing night of music. If you appreciate tonight's music, we welcome your donations to a worthy cause, providing free medical care to poor people who otherwise would never see a doctor or a nurse. We're talking about disenfranchised people who live in the Dominican Republic on the border of Haiti. I am part of International Medical Alliance of Tennessee, IMA. Our all-volunteer group of doctors, nurses, and medical students goes to the DR several times a year. The people who live on the border towns of Haiti and the DR are a stateless people who were wooed to the Dominican Republic generations ago with the promise of citizenship in the Dominican Republic if they agreed to work for meager wages in the sugarcane fields. The promise never happened. Citizenship never came. They have no legal identification papers. That means they cannot formally work or attend university or get medical assistance or travel. They are invisible to the DR government. They effectively have no rights. Now, generations later, we give these disenfranchised families the medical care that they never received before we started going there. I spend my weeks there wearing several different hats. I interpret between Spanish-speaking patients and the English-speaking doctors during exams, whether it's in one of our formal clinics or whether it's in somebody's private home. I use my decades of mental health training to debrief our medical students after long days being submerged in abject poverty. We do general medicine, women's health for pap smears, pediatrics, dental care, and we even have an eye team that comes in. Each day, like a MASH unit, we are in a different village, sometimes going into the mountains on flatbed trucks. We spend the day seeing everyone in the village who needs to be seen. Our team of eye specialists focus on surgeries for cataracts. The GYN surgeons focus on removing cancerous and precancerous cells for women when pap smears identify problems. We change the trajectory of people's lives. Helping someone see after they've spent years not seeing due to cataracts is life-changing. And removing cancerous uterine cells is life-saving. Giving someone anti-inflammatory medication for his swollen hands or her arthritic back due to a lifetime of hard labor is transformative. We also offer our chronically ill patients who suffer with diabetes or high blood pressure a year's worth of medication. Over the course of the 14 years I've gone down, I've seen a dramatic change in health of the communities. People are eating more healthily, they're exercising, walking in the evenings, taking their prescribed medications as instructed. Over time, we've actually stopped going to some villages because people have learned to take better care of themselves and they've become much healthier. By visiting the same villages year after year, we are not seen as aid workers, coming in and then leaving without a trace. We're seen as medical providers that these communities have learned to trust, which has impacted an entire generation and promoted a new sense of well-being and health advocacy. We are a mom and pop organization with no paid staffers. Absolutely nobody gets paid. We are all volunteers, even including the director and her husband. We all pay our own way, our travel, the food we consume, the medications we give out. So 100% of your donations go directly to patient care. This pandemic has been catastrophic for everyone, and the poorest of the poor have been subjected to even harsher conditions with even less access to health care. The amount of donations we have received has dramatically declined. Last year, 2021, you were amazing with your donations. You helped IMA continue to return to the DR, albeit with a tiny group, to distribute the most important meds to the chronically ill. As you think about giving this year, please consider giving the gift of sight, of diabetes medication, and health services to people who otherwise have no access to it. The donation link on the screen will take you to a page where you can donate with your credit card, PayPal, or even by check. Thank you so much and enjoy the rest of the show.